All right, everybody. Thank you for your patience. We will get started now. First, before I jump in, hopefully everybody can hear me. Please let me, please confirm if you can. Don't need everybody, but if you can chime in on the chat to confirm that you can hear me. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. We are very glad that all of you are joining us today. We have over 300 and going on close to 400 attendees. We may even hit 500 by the course of this presentation. So thank you. We're really glad you're here, and we're really glad to be offering this to you. So today's webinar is going to be an overview of Chicago's reopening plan for businesses. So this is an hour webinar. I'm going to give an overview of the structure of our reopening. As you know, the mayor has announced that we're going to be moving into phase 3 of the Chicago reopening framework next Wednesday, June 3rd. The mayor also released earlier this week industry-specific guidelines for various different industries, all the different industries that will be reopening or will be potentially changing the way they are operating next week. So the goal of today's webinar is to provide an overview and answer some kind of very important questions about that reopening plan that I'm sure lots of businesses have right now. I will say again, though, this is just an hour webinar. And before we even get into it, we will not be able to go into all of the detail on all of the 13 different guidelines that were released early this week. And as I said, with now over 400 attendees, I will not be able to answer every single question that comes in. So what I will ask is, if you do have questions, please submit them through the chat. Please use the chat and not the Q&A, because I'm not going to be able to look at two different sources. So please use the chat if you have any questions, and I'll do my best to answer them. But again, with over 400 attendees and with a lot of detail being covered, I will not be able to answer every single question over the course of this webinar. But I will have an email on every slide other than this main one that you can ask any follow-up questions to. So again, please use the chat for any questions, and please email questions that you have to the email that I will be providing again on every screen as I go through this PowerPoint. Before I get started and get into all of the details on the reopening, first let me cover the agenda. So we're really going to be discussing phase 3. I do not have any information on phase 4. On items that the mayor has not mentioned will be reopening yet. Or we will be sharing those, I promise, as soon as they're ready, but we don't have any additional information at this point. So I'm going to go over phase 3, the overview and criteria. I'm going to cover reopening guidance for specific sectors, and then other resources available for businesses. And I'm going to put this website on the screen. It'll be on a couple other screens, chicago.gov/reopening. That's your source for everything related to reopening. And before I get specifically into the industry guidelines, I'm very excited to be joined today for just a couple minutes in her incredibly busy and important schedule, Dr. Jennifer Suh, Medical Director from Chicago's Department of Public Health. And we invited her here today to talk a little bit about the health metrics and how we ended up in phase 3 and why we're ready to be moving to cautiously reopen starting next Wednesday, June 3rd. So Dr. Suh, if I can pass it over to you to talk a little bit about a Protecting Chicago framework and how and why we're ready to transition to phase 3.
Yes, good afternoon, everyone. I'm really happy to be here. So I will go over, as Isaac mentioned, where we are with the health metrics and why we feel cautiously optimistic that June 3rd is a safe opening date for our city. So as you may all be aware, we are currently in phase 2. So we're at the stay-at-home phase where we're guarding against unsafe interactions with others. Right now, those who are going to work are essential workers. And over the last month, we added on for example, nurseries and gardens as well, in terms of businesses that could open up. Others are staying at home and working from home at the moment. We're still encouraging at this point for folks to be staying at home as much as possible. And when people are going outside of the home, going into grocery stores, in a situation where they can't do that over 6 foot physical distancing, we have been encouraging that everyone wear a face covering. In terms of what's different in phase 3, as again, you all know, is that we are able to open up some more of our cities. So non-essential workers will be returning to work in a phased way, not all at once. There are select businesses that have been allowed to open up as well, but with certain protections that need to be in place. Physical distancing is still going to be recommended, maintaining that over 6 foot distance whenever possible, wearing a face covering in situations where that isn't possible. In terms of gatherings, we are going to be recommending that gatherings be limited to 10 people or fewer. And again, that we're going to be opening up our public amenities in a phased way. We still want people to stay at home if you can, and definitely if you have any symptoms of COVID-19, if you've been diagnosed with COVID-19 or you've come into contact with COVID-19, folks should continue to stay at home. So those guidelines haven't changed. But again, the important thing is to continue to physically distance whenever possible, good hand hygiene. And then the added thing too is to make sure that if you have symptoms, now that we have expanded testing in our city, that you reach out to a medical provider to get tested. Next slide, please. So there were some public health metrics that we had outlined that will allow us to know whether we are at a place where we can move to the next phase. And we, again, are cautiously optimistic that we're gonna be ready to reopen on June 3rd. So I'll just go over some of those metrics here. So the first large group of measures that we were looking at were the rates of new COVID-19 cases. So whether that's actual numbers of cases or case incidents, or the percent positivity, meaning the percent of people who are getting tested who are testing positive. We wanted to make sure that those numbers were starting to go down. And we're at that point now. So we are seeing the cases are still high, but they are continuing to decrease. And we are seeing a decrease in that percent positivity. And we've been watching that over the last month, and we've been on that kind of decline or of cases or decline in the percent positivity for about the last 15 days or so. We also wanted to make sure that we're seeing stable or declining rates of cases that needed to be hospitalized, in particular, those who needed to be admitted to an intensive care unit, deaths related to COVID-19. And again, we are happy that those numbers that would indicate severe COVID-19 disease, that those numbers have been declining over several days. Another measure that we look at to see where we are in terms of a city and our the impact of COVID-19 is those who are coming into emergency departments with influenza-like illness or those symptoms or COVID-like illness. And again, we've been happy to see that those numbers have also been declining over several days. The whole goal of stay at home was to make sure that the number of cases and the number of cases that were coming in were at a speed or a level where our hospital system could keep up, so that our hospital, our healthcare provider colleagues would be able to treat and manage those individuals who needed to be hospitalized. And again, this is where we've been in a good place for several weeks. So we were looking at the number of hospital beds that were being occupied by patients with COVID-19, specifically intensive care unit beds, and the number of COVID-19 patients who require to be on a ventilator. And again, we have been at goal for those measures for several weeks now. But the idea is that we need to continue to move cautiously to reopen and continue to do our preventive measures so that the hospital system will continue to maintain capacity. The other thing we wanted to ensure before we reopened the city was that testing capacity was where we needed to be, because we need to know who has COVID-19, so then we can appropriately isolate or quarantine people who needed to be quarantined to reduce spread within our city. So our goal was to be able to test at least 5% of our Chicago residents, which turns out to about 4,500 tests a day. And again, we've been very happy to see that actually we have exceeded that goal. Right now, we're at about a little over 5,000 tests per day. And again, this gives us an idea of who has COVID. So again, we can isolate folks who need to be isolated, quarantine those who need to be quarantined to reduce transmission in our city. We've been, like I mentioned before, looking at the percent positivity, and this is where we're still kind of cautiously watching the numbers. We have two different goals. So in congregate settings, so like homeless shelters, jails, nursing homes, we wanted that percent positivity, number of positive tests to be less than 30%, and we've met that goal. In the community setting, though, we're not yet at that less than 15% positivity, but we're moving in the right direction. So right now we're at about 16.3% overall for the city. There are areas of our city, like our west and south sides, where those where that number is higher. But again, we're moving in the right direction. And then finally, we wanted to make sure that we had the adequate response capacity to address those who have COVID-19, a system in place to do contact tracing, again, to find those who needed to be isolated or quarantined to reduce transmission in the city. You may have heard about the RFP and the funding to partner up with community organizations to create a robust contact tracing program in our city. So again, that's something that we've made progress in. And overall, we've made good progress. And this is all thanks to all Chicago residents, to all of you for doing all those preventive measures, staying at home, encouraging patrons, friends, neighbors to do the same thing. So we feel cautiously optimistic that we're ready to reopen on June 3rd. But again, it will things will be different. We're not going to be going back to our pre-COVID era. In your businesses, there will be several measures that need to be taken. And, you know, broadly speaking, it's continuing what we've been doing. So physical distancing. So there will be changes, policies, operational measures that need to be taken to allow for that physical distancing to happen within your businesses or the public facilities that you work out of. And then, you know, we know that hand hygiene is very important. So ensuring that it's easy for patrons, for staff to clean their hands frequently throughout the day, and ensuring that the facility, the physical space itself, is also being cleaned and disinfected more frequently than likely in the pre-COVID era. So, you know, we're at a good place right now to do that reopening. I want to stress the importance of maintaining our preventive measures now. I know that all of you have been working hard to prepare your businesses, your organizations for this reopening. Just wanted to thank you again for all of that. With that, I'll turn it back to Isaac. Thank you.
Thank you, Dr. Suh. I know you are jumping onto another webinar, I believe, right after this. So we really appreciate you taking the time. And I know you've done a couple of these with us, so really appreciate it. And I know there's been a couple questions coming through. I think these are things that either will be covered later, or I'll make sure to try to get back to those questions when we're into that section. I did want to make sure that Dr. Suh let us all know, because we want to make sure that this whole conversation, as it has from the beginning, is couched in the health terms. Everything is about the health effects and the health impacts. And we, you know, we are ready to go on June 3rd into this cautiously reopen, into this phase 3, because our health metrics are telling us so. We're not arbitrarily picking June 3rd. So you mentioned Dr. Suh say that they're cautiously optimistic, you know, about entering phase 3. We are, you know, as a city, planning on entering phase 3 on June 3rd. We know that businesses need to have a little bit of time to plan, a little bit of heads up. And as Dr. Suh mentioned, while we haven't quite reached the exact metric on some of these things, we're moving in the right direction and confident that we will do so on by June 3rd. And just to, you know, as the mayor has said a couple times, you know, this is not a there is the opportunity, if things do not go well, to potentially move back to phase 2, staying at home, which is why it is so critical that we do follow these guidelines. So without more ado, I'm going to start jumping in. So phase 3 date, June 3rd, 2020. These sectors that I'm going to go over right now are the industries that can reopen with capacity constraints and safety guidance starting on June 3rd. This is childcare centers, city services. So city services will actually be opening up on June 8th once we are further into phase 3, but city services will be opening up in phase 3. Office-based jobs, professional services, real estate services, accommodations and tourism, hotels, lodgings, outdoor attractions, which includes non-lakefront golf courses and boating, not including the playpen. And then specifically, I know for a lot of folks here, retail. So non-essential retail that has been closed other than curbside pickup and delivery will now be able to reopen under restrictions. Personal services such as hair, nail salons, barbershops, tattoo parlors, massage establishments, medical spas, they can reopen again under limited capacity and restrictions. And finally, health and fitness. Gyms do have kind of a very specific health risk there, so there are specific restrictions in place for health and fitness. And then finally, restaurants and coffee shops can open with outdoor dining only. And I'll get into some detail on what exactly that means. I had a question coming through. What is the playpen? That is a place in where boats will kind of gather to have have congregate activity. That will not be open. So with food services, Mayor has made it clear, bars and lounges, nightclubs will not be opening. Any place that only serves alcohol and does not have any retail food component, they will not be able to reopen immediately under phase 3. So in order to open under the food service industry, you will need to have a retail food establishment license and to be selling and serving food. And now if you do that, you can also serve alcohol. So in addition, in phase 3, industries that are already open can continue or expand operations in phase 3. These are things like B2b industries, manufacturing, construction, warehousing, healthcare, such as hospitals, dentists, community mental health, and federally qualified health sectors, and transportation, public transit, regional transit, taxi, and rideshare. And for each one of those, we do have specific industry guidelines. And for each one of those that I mentioned on the last slide, we also have specific industry guidelines. Other subsectors may be reopening later in phase 3, but are not going to be reopening on June 3rd. For example, summer programs and youth activities, religious services, the lakefront, outdoor performances, and museums. Now, we anticipate and hope that they can open in phase 3, but these things will not be opening at the beginning of phase 3, will not be opening on June 3rd. And then other subsectors highlighted here will remain closed for the time being. These are schools, playgrounds, bars and lounges, like I mentioned, and large venues, stadiums, indoor theaters, music venues, convention centers, any place where large people gather, more than that gathering of 10 number that Dr. Suh mentioned. To clarify a little bit on this, especially this large venue section, if, for example, a movie theater that is that maybe is unable to open but does have a restaurant built in, the portion of it that can reopen will be allowed to do so. But you cannot have kind of these large venue spaces. So I am seeing a couple questions coming through confirming that fitness centers can reopen on June 3rd. Yes, fitness centers can reopen on June 3rd. I will get into the specific guidelines for health and fitness centers a little bit later on. I want to talk a little bit more about the different industries that are opening up and tell you, again, this is just a 1-hour webinar to cover everything related to reopening. And I'm not going to be able to get into a lot of the detail that some of these different industries require. And that's why next week, we're going to have specific hour-long webinars for the 5 different industries you see in front of you right now. So personal services, hair, nail salons, massage establishments, etc., we'll have a webinar on Monday at 3 p.m. Detailed for health and fitness will be on Tuesday at 12 p.m. at noon. Food service, including the outdoor dining, will be June 2nd, Tuesday at 4 p.m. Retail, Wednesday at 4 p.m. and commercial buildings, Thursday at 4 p.m. Now, a couple of questions come through about if this PowerPoint is available. This is being recorded, and we will put it hopefully by the end of the day today. Folks on my team that are listening in, hopefully by the end of the day today, we will have this webinar up on our website at chicago.gov/businessworkshops, the same place that you registered for today. Great. And then also, I wanted to emphasize, I see a ton of questions coming in. We will be, any question that I'm unable to answer, please email to bacpoutreach@cityofchicago.org. So that email, send an email there, and we will work to get, we have a committee working on all these questions, and we'll work to get you an answer as soon as possible. Great. And I know folks have a lot of questions about maybe their industry, maybe their business doesn't exactly fit within one of the industries, or might be a gray area, or it's part a movie theater, part this, part that, and what exactly fits into there. So a little bit of an explanation there. Our general guidelines guidance is to use your own discretion and to evaluate whether you as a business, where exactly you fall. These are intended to be guidance and guidelines. And if you're not 100% sure, use your discretion to determine which industry and which guidance you should be falling into. And additionally, though, this Monday we will be posting on that chicago.gov/reopening website. We will be posting there a matrix that really goes into a lot more detail with a lot of different businesses that'll help you understand. But if you still have questions, again, please do feel free to email bacpoutreach@cityofchicago.org. Now I want to take a little bit to talk to you about what is on chicago.gov/reopening. I recommend, if you haven't been there yet, to please go ahead and visit that website, because most of your questions, and I'm seeing, as these questions are coming through, a lot of your questions will be answered there. There will be industry guidelines. I believe there's 13 or 14 currently posted, and as soon as new ones are ready, they will be put up on the website. I mentioned on Monday, we will be posting additional information to help you understand what guidelines you fall into, but the guidelines will not be changing. The current guidelines are up there. They will not be changing. So please do check that for your industry guidelines. Again, chicago.gov/reopening. Also on that website, something very exciting that we're excited to be including is a self-certification program. Employees are encouraged to complete a self-certification based on their specific industry to prove that they understand what the rules are and understand what those guidelines are. You'll be asked a series of questions, and then you'll get a little badge that you can print and put up at your place of business. This shows that you are following and understand the Phase 3 guidelines. It also shows your consumers, your customers, that you know what the rules are and you have things in place in order to protect them. Because again, this is all about safety. This is all about making sure we're keeping our community safe while we cautiously reopen. Also on that site, you'll find additional resources, national, state resources on COVID-19. You'll find postings that you can put up at your location. And you will also find a ton of other information for you as you work to reopen. And I said additional questions. You can also call 311 if you have any questions. And again, it's up there. It's on every single slide. BACP outreach@cityofchicago.org. Great. So now I'm going to talk and spend really most of the rest of this webinar talking about these specific industry guidelines. Again, a lot of the questions that you guys have are answered within those industry guidelines. So every piece of guidelines has three main parts. Healthy interactions. How can businesses make sure that employees, customers, contractors are interacting with each other safely and responsibly? So social distancing, you've heard it since the beginning, and it's still that magic number of 6 feet. That means postings should be up showing how to be 6 feet apart. Tables should be 6 feet apart where relevant. Gathering size. So while businesses may be allowed to have more than 10 people in it, you'll find across the guidelines that the limit is 10 people to individual gatherings. Protective gear. Every specific guideline has some sort of protective gear requirement. It might be different depending on what exactly your industry is, but we know, health experts tell us, the importance of masks primarily to keep other people safe. So all guidelines do require masks in some, face coverings in some capacity. Then also hygiene requirements. How often you should be cleaning, how often you should be washing your hands. Should be all the time, but there's kind of specific guidelines for different industries. Next, each guideline goes into safe spaces and conditions. How to provide access to your building, entry access, things like that. Cleaning standards. How often should you clean? What should you clean? And then visual guidance. What should be posted, and what and how and who what that information should be. And then workplace conditions. What should you be doing to keep your workplace safe? Finally, operational resilience and monitoring. What should you do to keep your operation safe and healthy into the future? So flexible models, operational resiliency, travel guidelines, how and when should you be talking to your employees about traveling, and then testing and tracking and what you should be doing there. And also on every piece of guidelines, you'll have a glossary, a little overview of what social distancing means, what hand washing means, things like that. A self-screening questionnaire that employees and employers can use. And I'll go into that in a little bit more detail. And then additional public health resources. So I strongly, again, recommend, if you haven't done so already, please visit chicago.gov/reopening and dive into your specific industry's guidelines. What I'm going to do now, though, is go over 4 of those different industry guidelines in a little bit more detail so that I can make sure that folks understand on some of the most relevant business guidelines, that folks can understand what the guidelines are and how they can follow them. And I'll have some time to answer questions on each of these specific ones as we're going through. So first, I'm going to start with food services. So on each one, if you go to any of the guidelines, you will see that they have an image on that first page on every single one of those guidelines. And this gives you a nice little visual of what you will be seeing differently and what you should be doing differently come June 3rd when you open. First, contactless pickup should be available, and contactless payment is strongly encouraged. Outdoor dining is permitted. Again, starting June 3rd, you can open for outdoor dining. This is something that has not been allowed before. Let me go over what outdoor dining means, though, in a little bit more detail, because this is really important. So what exactly do we mean by outdoor dining? So first, outdoor dining is any place that is obviously outdoors, that meaning a sidewalk cafe, an outdoor patio. We're working to put together additional permits that'll allow folks to potentially be out in parking lots, things like that. So any place in which you are completely outdoors. Also rooftops are considered outdoor dining. Rooms with retractable roofs are considered outdoor dining. And finally, any indoor space where 50% or more of a wall can be removed by opening a window, door, or panel, that can be considered outdoor dining, provided that the tables are 8 feet away from those open windows. So, you know, restaurants that might have a big open window where there's panels that can be removed in the front, As long as tables are within 8 feet of that opening, then they can reopen for dining. So a lot of questions about this. So importantly, everything does need to be licensed or permitted by the city of Chicago. So outdoor patios, rooftops, they do need to get an outdoor patio license. Sidewalk cafes do need to get a sidewalk cafe license, a sidewalk cafe permit through BACP. And we're working on expediting and making these permits easier for folks to get them. But in the meantime, we are continuing to process sidewalk cafe permits. And we'll be, as soon as we have more information to share about other available permits or about an expedited form of these, we will be sharing that. So I said, social distancing requirements. So every table needs to be 6 feet apart from other tables. Food services does not have any capacity requirement. It is not a capacity requirement. It's not 25%. It's not 50%. The requirement is that tables must be 6 feet apart from other tables. Every table must be 6 feet apart. And if you're indoor with that open window, again, they cannot be further than 8 feet from that open window. The rest of the tables that are further than 8 feet inside cannot be used. So there's no exact capacity requirement. I'll go into a little bit more detail about those tables in just 1 second. There should be visual signage posted throughout facilities. This is really the case for everyone that's opening. And those signage can be found at chicago.gov/reopening. Employees are required to wear face coverings at all times, and guests should be wearing face coverings when they are not seated. When guests are seating, they do not need to wear face coverings, but at all other times they should. That means, and this was a question that came through right at the beginning, if somebody is walking from your sidewalk cafe into your inside bathroom, they should be wearing a face covering. If they are walking through the indoor location in order to get to a patio, they should be wearing the face covering. So folks should be wearing face covering anytime that they're not sitting down. Let me just pull this up because this has a lot more of those details. So in addition to spacing tables 6 feet apart, so the guidance does say tables spaced 6 feet apart. You should also limit gatherings to no more than 10 individuals and limit the amount of people on each table to no more than 6. Again, each table should have no more than 6 people, and total gatherings should have no more than 10. That means you can't have, 6 tables that are all kind of a part of the same party. The individual gatherings where people are gathering for the same purpose all together, where they all know each other, they cannot have more than 10 total people. This is a requirement across the board in phase 3. You can't have a party, a get together with more than 10 people. If 6-foot distancing is not possible, then you need to use impermeable barriers. You need to ensure that hand sanitizer or hand washing facilities are readily available for both customers and employee use. And again, face coverings anytime a customer is not seated and eating. Regarding the safe places and working conditions, you should be eliminating bar counter seating. You should not have any bar or counter seating, even if it fits within the other sort of requirements, unless the primary purpose is food. We encourage fixed board or digital menus. And you really should be providing disposable table items when possible. And any non-disposable table item, you should be cleaning after every use. And you should not be having any self-serve food or drink stations. For operations and monitoring, you should be limiting overlap if practical. You should be encouraging contactless ordering and payment when possible. And finally, encouraging reservations. We know that there will be limited seating available, so we do encourage folks to be using reservations. I want to take a minute. I saw a couple questions come in. As I said, every place that is outdoor dining does need to be licensed or permitted for that use. At this point, we do have existing licenses and permits, but we're also working to develop new licenses and permits that are not available at this point, but we're hoping to be announcing very soon. We're also looking into potential other ways that we can help folks out during this time. Wanted a little bit more clarity, I see, on the 10 people versus the 6 people for tables and gatherings. So let me start really at tables. Every table should be 6 feet apart, and there should be no more than 6 people at a table. The clarity on when I say there shouldn't be any more than 10 people in a gathering is, imagine you have a party of 15 that is showing up at your restaurant and wants to all eat together. They cannot do that even if they are at multiple tables. You can't have one gathering where people are all there, they all know each other, they're all there for the same reason. You cannot have a gathering of more than 10 people, even if they are at more than 6 feet apart at the tables, because we know that that will lead to folks walking over to the other tables and congregating, and you can't congregate with more than 10 people. So I do want to move on to some of the other guidelines. We will be, again, having an industry-specific full hour just on food service. But I do want to make sure that if we did not get to your question, that I can answer that via email at bacpoutreach@cityofchicago.org. Great. Now I want to talk, I know there were a couple other questions that come in. I'll try to get to them at the end. I'll try to get to them at the end, but I want to get into some other guidelines. I want to talk first now about retail. Again, if you go to the retail guidelines at chicago.gov/reopening, you can find some images and all of these details. So retail is a little bit different because a lot of retail, again, has been open already. So things are not, things may not be totally different for a lot of these folks. So I'm going to jump into the more detailed page really quick, and I'm going to talk through the guidelines specifically for retail. So first, retail should be limiting their capacity to 25% for non-essential retail and 50% for essential retail. So again, retail should have capacity restrictions. And this, when I say essential versus non-essential, this means essential retail are those folks that have been open already under the governor's stay-at-home order. You know, hardware stores, auto shops, food and beverage stores, grocery stores, things like that, that have already been open, they can be at 50% capacity. Non-essential retail, flower shops, clothing stores, things like that, they should be at 25% capacity. And the reason for that is that, as the mayor's talked about, we're not flipping a switch coming June 3rd. We are turning a dimmer. We're trying to open cautiously and ramp up slowly. So folks that have not been open yet, we want you to start with 25% capacity. You should be installing 6-foot floor markings in any place where individuals queue or congregate. You should be requiring face coverings for everyone in outdoor or indoor common space. All retail, that's employees, that's customers, should be having face coverings. And then limiting your gatherings and choke points to 10 or fewer. So break rooms, places where employees or customers may congregate, you should always be limiting gatherings to 10 or fewer. That's your magic number anytime you have gatherings, no matter what your business is like. You should know this in your personal life. We're limiting gatherings to 10 or fewer. Finally, you should be providing sanitizing products for customer use. For example, grocery stores should be having the ability for customers to sanitize their carts, things like that. You should be conducting a health screening prior to entry. Now, this is a point that I do want to clarify, because this is something across all different guidelines, having some sort of health self-screening prior to entry. In clarifying what exactly this means, and this was asked at the beginning as well, so I saw someone ask this question at the beginning. What exactly do we mean by health screenings? So this is something that can be done as a self-screening by an employee themselves, or it can be done by the employer asking a series of questions to the employee. City of Chicago is not requiring a temperature check for before employees enter the business, but they should be doing some sort of self-screening. Do I have a fever? Do I have a cough? Do I have anything like that? And if you are sick, you should be staying home. That is something that people should be monitoring at all times. We are reopening cautiously, but that guidance is not and will not be changed. If you are sick, any sort of symptoms, you should be staying home. So I had a question about how to figure out capacity. A lot of businesses do not have, depending on their size, do not have a defined occupancy or a defined capacity. That is something that we are kind of leaving to the business themselves. There isn't a definitive, this is exactly by square feet how you determine capacity. Rather, that is, we're providing this kind of as guidelines for you, the business owner. You should be looking at your typical, how many folks you may have in your location typically, and then bring that down to 25% if you're non-essential, 50% if you are essential. I had a question about how this kind of interplays with the 6 feet, interplays with the Illinois health screening. Illinois does, they mention a little bit that you should have kind of twice a day health screenings. What we're saying in our guidelines is that the health screening should really be a constant thing that employees are doing. We're calling it an employee self-screen, but employees should be monitoring their symptoms all the time. So we're not requiring, a formal health screening twice a day for employees, but we are saying it should be a constant thing. You should be screening yourself constantly over the course of the day. So really, it's a constant thing, this health screening. Right. So you should be disinfecting all high-touch areas between customers. You should be posting signage for social distancing and face coverings at the entrance and the checkout. And you should be adjusting your navigation to ensure social distancing. You should be making it very, very easy for your customers to social distance. One-way aisles is something that we do strongly recommend folks to do. And even as you're reopening, we encourage curbside delivery and contactless payment. Curbside and delivery and contactless payment. A lot of folks have, I know, set up some really creative curbside pickup. And even again, as we're reopening, this is a dimmer switch. We still do encourage curbside pickup. Had some questions about signage that businesses can print out. At chicago.gov/reopening, you can find all the signage that you need for the business. And if there's anything specific that beyond that, please do let us know. We specifically at grocery stores, we recommend vulnerable shopping hours. So folks that need to go but may be vulnerable since they are elderly or have underlying conditions, they will have the opportunity to do that. Also, where possible, limit travel across multiple retail locations. So limiting travel across multiple retail locations where possible. You shouldn't really be having your employees work at multiple different stores. They should be sticking, this is something really across the board in all different businesses. If you have multiple retail locations, they should be sticking at that one location. It's really just best practices. So I see a couple questions coming in. Questions about sign and printing companies can be considered essential. As we said, our definition of retail is a really broad definition. So unless it was something I kind of explicitly said at the beginning that cannot be opening, bars, lounges, large event spaces, schools, playgrounds, unless it's something like that, then they can be opening and can be considered essential. And again, on Monday, we will be publishing a full list of kind of all businesses you can think of and what industry they fall in. So there's a pretty wide range of what we're considering retail and what can be considered reopening under these guidelines. All right, as we have just about 15 minutes left, I do want to talk about health and fitness because this is something I know we will be getting a lot of questions. I want to remind folks that we will be doing an individual webinar just on health and fitness, along with retail separate, food and service, commercial buildings, and personal services next week. And I'm going to type this into the chat, but it's the same way you registered for this one. You can register for those at chicago.gov/business workshops. So really quickly, health and fitness guidelines. The most important thing are these first 2 bullet points here. Health and fitness can open, and they have not been open before, can open up with outdoor classes of no more than 10 people with proper social distancing, with 6 feet between everybody. So outdoor classes of no more than 10 people. Indoor, anything indoor for gyms, health, fitness centers, yoga studios fit under this as well. Only one-on-one training indoors. That means no classes inside, no classes in which you have like one instructor and multiple attendees, and no individual workout sessions are allowed. No sessions where people are kind of working out by themselves within a gym. And this is something, we developed these guidelines in very, very close consultation with the health department. And gyms really have a unique risk for transmission. So we do want to make sure that there are very strict guidelines in place for health and fitness. Anything ancillary to the workouts should be closed. Locker rooms, saunas, steam rooms, childcare, lounges, anything like that to prevent gatherings. And someone just asked a very important question, and I should have clarified. One-on-one training indoors, that means you can have multiple trainings going on at the same time, as long as each one of them is one-on-one. For example, if you have 10 trainers, each one of those trainers can have one guest that they are training. So it's not just one person inside at a time. As long as everybody is one-on-one, then they can be allowed to operate indoors, as long as proper social distancing is in place. Face coverings must be worn by everybody while physical activity is happening. So while working out, you must be wearing face coverings, whether you're indoors in one-on-one training or outdoors with no more than 10 people. This is something that really should be used. Anyway, but regular sanitation of hands and high-touch areas. Hopefully, all gyms are doing that anyway. But please do that. Again, employees should do a health self-screening prior to entry. This does not need to be a temperature check explicitly, but there should be some self-screening done prior to entry. There should be deep cleaning every night, in addition to frequently daily cleanings. You should have visual guidance. Again, those things that you can find on our website to print, they can be and should be posted throughout any indoor location. Please encourage people to come fully dressed and ready to go, because locker rooms should be closed. And this is something very important with gyms. Again, probably should be doing this anyway, but increasing airflow of indoor spaces, windows, HVAC, things like that. Your operations, this is also the case across all types of industries. Limit as much as possible in-person work. If you, for example, have a staff meeting with your trainers, try to do that virtual. Just because we're opening up doesn't mean we should be stopping all of our good things that we've been done before. And limit interactions and overlap between individuals. While you are allowed to have, for example, 10 trainers and 10 clients, try to limit the amount of overlap and how close they are to each other. And then also, again, limit travel between gyms. You should, people really should be just working at one gym. Great. So I do want to, again, I see a ton of great questions coming through, and I'm going to try to answer as many of them as I can at the end. But I do want to make sure I get through all my guidelines first. So the last guideline we're going to be covering in detail today is personal services. Personal services mean hair, nail salons, massage establishments, tattoo parlors, medical spas, things like that, where you're really, providing one-on-one personal service to someone. These have a capacity limit. Personal services, yes. So I got a couple questions about other kind of medical things. If you were not open before and you're kind of a one-on-one service, then you would be considered personal service. So acupuncture would be considered a personal service. Limit capacity to 25%. Sorry, I see some questions coming through, and this is probably an important thing to clarify. I had some questions about what qualifies deep cleaning, how to sanitize, things like that. If you go to the guidelines at chicago.gov/reopening, there is a ton of guidance specifically on what this cleaning means and what and how exactly to do the cleaning. So I don't have that here, and I'll make sure to that is there. So limit capacity to 25%, again, at any hair, nail salons, tanning salons, things like that. Limit capacity to 25%. Every other workstation should be decommissioned unless you have impermeable barriers and unless you have 6 feet of physical distance. So let's take the hair salon, for example. If your chairs are already 6 feet apart, you do not need to decommission every other chair. If you have an impermeable barrier between chairs, then you do not need to have any sort of decommission between them. But if they're less than 6 feet and there's no barrier between them, then you do need to decommission every other workstation. Face coverings should be used in all outdoor or indoor common spaces. We also are recommending that if the employee is having close contact with the customer, that they also wear gloves. That's the only one. The other ones were not required to wear gloves. Limit gatherings, again, to 10 or fewer, and also provide training courses with proper hygiene, disinfection, and sanitation practices. The World Health Organization has a great training course for folks related to this. Employees, again, should be conducting that self-screening prior to entry. And you should be disinfecting and sanitizing all equipment after each client. You should be providing visual guidance on hygiene standards and entry requirements. And again, like other places, you should be increasing airflow of indoor spaces through windows, HVAC, etc. These are all, again, similar stuff to what we've had on other things. Do your best to minimize client overlap. You should really, just like trainers in a gym, you should just be one-on-one. You should not be having multiple clients with the same employee. For example, you shouldn't have, while somebody is finishing up a shampoo, having someone else start their haircut. You really should be just doing one-on-one with no overlap in clients. It's really important that we are minimizing risk at personal services. Saw a question about massage establishments. Massage establishments are limited through state guidelines to 30-minute massages. Regarding the gloves question, again, we're recommending that stylists, that folks that are having very, very close contact with individuals, to be wearing gloves. Really quickly, I wanted to cover a couple other sectors that we're not going into a ton of detail right now, but and there's much more information on our industry guidelines at chicago.gov/reopening. And I do apologize, I see a typo here that I'll mention. Commercial buildings. We're going to do a full training on commercial buildings next week, but all gathering areas that cannot have social distancing should be closed. You really should be varying start and stop times so we don't have everybody showing up at once. Workplaces should be separated by impermeable barriers where possible. And face coverings should be worn at all times in common areas where 6 foot of distance is not possible. Parks and outdoor recreations. We'll have more information again on city services opening on June 8th. Outdoor activities should be limited to non-contact sports in small groups only. Even while outdoors, you should have social distancing of 6 feet. All gatherings, again, I've said this many times, should be limited to no more than 10 individuals. Even if you're in an outdoor space, any people gathered kind of for the same purpose should never have more than 10 individuals. And capacity should be limited to 25% wherever you have anything indoors, restroom facilities, exhibit spaces, things like that. Then this last one should say childcare. I apologize for that typo there. There are very specific rules for childcare, and if that is your business, I do recommend that you read those in very specific detail, because congregate settings like that, while reopening, do have a lot of risk. You should be limiting group size to 10 or fewer children. You also should be doing temperature checks for children at the entrance before they come in. That is very, very important. It's the only industry for which we are requiring temperature checks. And parents are expected to be waiting in designated areas. So this is kind of, again, we're getting close to wrapping up. So I want to kind of summarize and let's talk about a couple of the questions that we've seen in detail. One question I've seen is a little bit about how Chicago's guidance interplays with the state. As you know, the state has their own guidance for a lot of this, and Chicago did go stricter than the state in a couple instances. But for the most part, our guidance does mimic that from the state. I want to also very quickly, before I try to cover a couple questions that come through, I want to point people again back to chicago.gov/reopening in order to get the self-certification. Be safe, Chicago. The citywide slogan is changing from stay home and save lives to be safe, Chicago. It's critical that we open safely, and I encourage everybody to go to the reopening website and to follow the restrictions. To take that survey and make sure you're reopening. Also, finally, and the website is here on the page. We know that a lot of businesses might have some difficulty finding protective shields, hand sanitizer, face masks, things like that. And that's why we established a PPE market for personal protective equipment, specifically for Chicago small businesses, CBOs, and not-for-profits. So please visit ChicagoPPEmarket.com to register, and you can get these prices, get these items at very competitive prices. Now I'm going to take a minute to go through as many of the questions as I can that I saw come through. We have over 500 attendees, and we are wrapping up in just a couple minutes. So I do want to make sure that folks are emailing, and it's on here right now, bacpoutreach@cityofchicago.org. We know that I've been unable to answer every single question that came through, and I do apologize for that. So please please send emails there to send any emails. So let me do a couple questions I saw come through. One question is about museums and art galleries. At this point, museums are not scheduled to be reopened on June 3rd, but we will be hoping to open them sometime during phase 3, and more communication will be coming about that. I had questions about fitness centers in hotels or in in apartment buildings. Fitness centers in apartment buildings and hotels, etc., should be following these same guidelines. That means you can only do indoor classes. You can only do indoor if you have one-on-one training. So if you don't have the opportunity for one-on-one training, I'm going to put this slide back up so people can see it for this link. If you don't have one-on-one trainers, you cannot have fitness centers open. I saw some questions about the CTA, because that is absolutely critical with employees coming to work now for the first time in a while. And I don't have it up here, and I'm not fully the expert on it, but there is specific CTA guidance about what exactly the CTA is doing to keep people safe and how passengers should be keeping themselves safe. And that's something that you can find, again, at chicago.gov/reopening. Wanted to clarify the businesses that retail businesses have a 25% capacity limit if you are non-essential, and 50% capacity limit if you were considered essential under the former stay-at-home order. So 25% capacity for what was non-essential retail, 50% capacity for essential retail. That 10-person limit I keep talking about, that is not a capacity restriction on locations. That is a restriction on individual gatherings. Individual gatherings where people are all gathered together in close space for kind of the same purpose. So you're not required to limit the total people within your location to 10 people. It is 25% capacity for non-essential retail, 50% for essential retail, and then 25% capacity at your personal services. And a reminder, restaurants with outdoor dining, they do not have a capacity restriction. Rather, the restriction is for, sorry, let me just type this up. The restriction for outdoor dining is requiring that folks have 6 feet apart. The tables are 6 feet apart. Great. And then fitness centers, there's no capacity requirement. The capacity for fitness centers, for health and fitness centers, is that you have one-on-one training and that people are 6 feet apart. Again, we are already past time. I do apologize for, I'm sure, the hundreds of questions that I was unable to answer. With 500 plus attendees, I do apologize for being unable to get to every single question. I do encourage you to email BACP outreach at cityofchicago.org. Me or someone from my team will follow up as soon as possible with answers. My name again is Isaac Reichman. I am the Director of Public Information at the City of Chicago, Department of Business Affairs and Consumer Protection. Please reach out to that email if you have any other questions. We know that this is an incredibly challenging and confusing time for a lot of folks. And we're doing our best to share this essential and complicated information. So if there's anything that you need clarification on, if there's anything that we can do better, please do not hesitate to reach out to us. And I will be following up with you guys. We do want to make sure that folks understand these rules, because this is absolutely critical for us to reopen safely. This is all about the health and safety of our community. We've done a wonderful job over the last 2 months, and we want to make sure that we're continuing to do that. So thank you all very much. Well done.